Thank you much, colleagues. I think that was a very encouraging video that we saw there of one of our stalwarts, our former president, encouraging us why we are part of Black Management Forum and why you should be encouraged to be a member of Black Management Forum. So we're very happy about him still being there and a pillar of strength to us as the Black Management Forum. Colleagues, today is one of the important days, I think, of tackling one of the crucial topics that the country is facing. The mental health issue is one of those topics that when you look at them, the numbers are going high when it comes to issues of mental health. And we saw it fit as BMF Limpopo that we need to really have a talk about this particular matter and take on ourselves that we need to be able to discuss promotion of mental health in the workplace. Because that is one thing that is very crucial, that the economy of this particular country depends on human capital for it to be driven and also grow. As you saw in the last quarter, also demonstrated to us that there are other industries that have been affected due to issues of COVID-19. Lots of companies changed workers due to the issue that they needed to cut costs and for them to stay afloat. But you must also understand you cut costs and you retrench other workers and others are remaining for making sure that the business keeps on running. Some of the other work that is supposed to be there for people, you find they're taking all those work and bring them to 1%. So all those things, when it happens like that, you find it brings a whole lot of pressure on an employee. Sometimes they don't even know what to do. You know, I gave somebody a call, a friend of mine somewhere, and he said they're working off at 5 o'clock. So around 7 o'clock, I gave them a call. And after I've called them at 7 o'clock, they said, I'm still busy, I'm still in the office. And I said, then it's fine, then I'll call you the following day. So the following day, I gave them a call. And I realized that they were still working when I called them around 8 o'clock in the morning. And they said, I'm chasing a deadline. In fact, I was in the office until 12 o'clock. I went home, I slept a little bit. I woke up around 3 o'clock in the morning because I'm chasing a deadline. So all those stresses that comes to the workforce and all those things that becomes triggers for mental illnesses, sometimes we take them for granted. And because we don't have an option as workforce to say, where should we go? So those are the things that we're going to be tackling today. We have called an expert and we have called the deputy president who's going to give us more light on the topic of mental health in the workplace. Because remember, as managers, somehow we have certain stresses that we have because they need the companies to run. But besides that, we also have other people that are under us that are going under stress, that we also need to make sure that they understand that their mental health comes first for the economy to be able to push. With this type of an introduction, I'm going to take this opportunity to introduce our guest speaker, who is Mr. Mokoti, who is a principal clinical psychologist. And he served in so many boards in HPCSA, in CESA. He also serves there. I can't read everything else that has to do with his resume and as well as his profile. But the current post that he's holding now, he's an acting chief clinical psychologist, head of clinical department in clinical psychology, and the provincial coordinator of psychological services. That's the position that he's holding now. He's one of the big guys in Limpopo who deals with clinical psychology. So I'm very happy to announce him, to give him an opportunity to come and take us through the topic of promoting mental health in the workplace. Ladies and gentlemen, let's give him an ear, and then we can be able to engage with him after the second speaker has spoken. Mr. Mukudi, over to you, sir. Mr. Mukudi.
Yes, I can hear you. I'm trying to switch on my video. I'm doing that.
Yes. Okay. Thank you very much, sir. I'm just going to switch off mine so that you should be the only one who's going to listen. Thank you very much, sir, for your time.
Thank you very much, Mr. Muthei, the chairperson, or the president. I'm very humbled to actually be part of what is happening today. And as you had introduced me, I'm a clinical psychologist, and I'm going to be talking as a clinical psychologist with regards to mental health in the workplace. I'm not very sure whether you're able to see me.
We see and hear you clearly.
We can hear you clearly and see you clearly. Yes.
Okay, it's fine. I think just to start my presentation, as you can see, I think the title of my presentation is Mental Health in a Workplace. And before I start this, I was just talking to a very a good friend of mine, I think yesterday. I also studied with this friend of mine. She's an industrial psychologist. And I actually decided to start my presentation with a quote. While we were talking, she quoted something. She had said to me, you know, employees are experiencing heightened levels of depression and burnout, and business needs to meet employees where they are. And I think with the opening statement that the president just mentioned, she's mentioned that, you know what, because of what is happening at the moment, I mean, with regard to the pandemic, there's been a lot of retrenchments, there's been a lot of companies being short-staffed, and as a result, there's been a lot of people trying to chase deadlines. And as a result, when that is happening, a lot of employees are feeling, you know what, our managers, our employers are supposed to be able to do something, because that actually results in them suffering some sort of mental health problems. Just to continue, I will start by, just a second. I will just start by giving you some statistics. You can go to the next slide. The next slide, please. That was just the code that I was talking. According to the stats that is compiled by the top 500 elite companies, recognizing the best in business in Africa, our national economy currently faces an annual cost of 15 billion, purely based on soaring levels of absenteeism. And one of the reasons why there is a lot of absenteeism is because of the mental health problems, or the unhealthy mental well-being with regard to the workplace. And most South African companies have an overall absenteeism rate of between 3.5 and 6%, way over the acceptable limit. And as you can see, you can really realize that, okay, that being the case, economy is really going to be affected very much. As mentioned in the effective employee index, lost productivity costs stood at almost 4.8% of the GOP at the end of 2019, which is actually a lot of money if one thinks about it. Lost productivity in South Africa can be equated to 280 million days, which is estimated to be 18.8 days per employee per year. So what I'm trying to say here is, in most cases, you find that for 18.8 days a year, some of the employees are not at work because of issues that has to do with mental health. So which shows that it is very important that we really need to look into how we actually taking care of our employees as managers. The biggest differences in sick diagnosis between males and females is depressive disorders. Depressive disorders are very common. In most cases, when we as managers are sometimes getting a sick note from our employees or our juniors, you find that, you know, in most cases it's because they are depressed. They are having some form of some depressive disorder. And one a mere 70% of men took sick leave because of depressive disorder. It is accounted by 1.2 of sick leave taken by women. As you can see, there's also a difference as far as the genders are concerned, and these statistics are very shocking. So in most cases, women are more likely to actually be on sick leave as compared to the females. Next slide, please. Globally, all the businesses are having to face the previously taboo notion of mental illness and physical disabilities negatively affecting their employees' ability to meet deliverables. That's true. I mean, they are not able to do that because of reasons such as, they are short-staffed, they are not motivated, they are stressed at work. So as a result, they are not able to actually meet the deliverables. With the rise of anxiety and insecurity related to career, family responsibility, and social functioning, South Africans have lost their livelihood, losing their jobs, their homes, and facing major declines in their health. And that being the case, if you think of all these things that I've mentioned there, losing jobs, losing homes, and having responsibilities as fathers and mothers, as providers, if you have all those things, that comes with a lot of stress. So as a result, if your mental health is not being taken care of, or maybe managers are really not supporting you to be able to have a good mental health, there will be a lot of problems at work. With the onset of such a vexing times, companies must rely on policies and intervention on hand to both assist employees and meet daily quotas, which has proven to be quite a hefty scale to balance. It's not very easy for companies to be able to do that. Regrettably, many South African companies do not even have established employee assistance programs or employee wellness programs, which traditionally includes confidential counseling and advice for employees based on an extensive range of work and personal issues. And that being the case, that could also be because when we think occupational health and safety, we're only thinking about physical safety. We disregard the mental, health as far as our safety is concerned. And as a result, some of the companies feel, they don't have to actually have a employee assistance program. And those are programs that are very important as far as mental health in the workplace is concerned. Investing in EAP is a staple constituent of any organization's risk and absence of management strategy, acting as a valuable resource for company managers and HR professionals. Hence, as I have mentioned before, the EAP programs are very important that each company should be able to do that. I also decided just to show you something with regard to what is happening in our province, which is the statistics, which is something that was in the news actually. The Department of Health in Limpopo is faced with, for instance, contingent liabilities of over 14, that's the next slide, 14 billion as a result of apparent medical negligence by staff at various facilities across the province. And in most cases, found that the root cause of a high rate of litigation include critical staff shortages, which I actually mentioned that is one of the things that at the later stage causes mental health problems, incompetency, staff well-being, which is also contributing to negligence and errors and misdiagnosis. So that being the case, you will realize that then the government is going to lose a lot of money because of those things. But if they have been supported, we would not actually be talking about that large amount of money. And so the aim of my presentation is to educate workers about the importance of mental health in the workplace and its implications on the health and safety of everyday work life. And of course, not disregarding also the economy, because that's also very important. Because if that is not being taken care of, we're going to have a lot of absenteeism, we're going to have a lot of staff shortages. There will be, injuries at work. As a result, the company might actually end up losing a lot of money because they are not really taking care of the mental health in a workplace. I'm on the slide on objectives. So the objectives of this presentation is for you to be able to know what mental health is and why is it important. And we also have to look into the mental health and culture, because that's also very important. How does culture, African traditional culture and Western culture match with regards to mental health? the implications of mental health in the workplace. By implications, I mean if that is not being taken care of, what happens as far as our workplace is concerned. And I also, at the end, point out 13 psychological and social, that is so psychosocial risk factors in the workplace, which really need to be looked into, because if those are looked into, then the mental health of the employees or of the workers will be taken care of. I'll also just talk about strategy and best practice for managing or to achieve good mental health in a workplace. Next slide. Everyone's mental health and well-being matters, including yours. I mean, if you're listening to me, one of the things that is also very important is you should also know that your mental health is also very important. In most cases, managers will only, take care of their employees or their juniors and forget that their mental health is also very important. I'm just wanting to actually mention that, you also need to think about your mental health, because if your mental health is not being taken care of, you will not be able to actually support or make sure that the mental health of your employees is taken care of. So this presentation is intended to be an educational tool. Some of the topics discussed are sensitive in nature, and they may cause you to experience unpleasant emotions. This is just a disclaimer that I also just want to mention before I start. If at any time you experience the above, I urge you to reach out for help. There are many resources that are available. I'll also mention some of those resources that are available. And please do not suffer in silence. It's okay to get help. All right. So what is mental health? Mental health is a state of well-being in which every individual realizes their own potential. They can cope with normal stress of life. They can work productively and fruitfully, and they are able to make contributions to their community. This is the definition according to the World Health Organization. So if you're looking at this, you will realize that, okay, there's a lot of aspects, a lot of domains that are very important as far as when we're talking mental health. Okay, next slide. These are examples of mental health problems and disorders. You'll notice my topics are at the bottom, and then the content is on top. These are just examples of mental health problems or disorders: depression, anxiety, burnout, compassion fatigue, the sleep disorder, substance abuse, eating disorder, bipolar mood disorder, schizophrenia, and other psychotic disorders. Sometimes we do actually get into contact with some of our employees who might actually have been diagnosed with this kind of disorders, but those are mental disorders. Next slide. But mental health is more than the absence of mental disorder. When we're talking mental health, we're not only talking about all those disorders that I've mentioned in the previous slides. We'll be talking about other things. Everyone experiences struggles in their life that may affect their mental health to different severity and for a varying length of time. This is a result of normal ups and downs in life. So in life, we do meet a lot of ups and downs. So as a result, that in itself affects our mental health. We do not have to be diagnosed with the mental disorders for us to be saying that our mental health is not adequate. A person's mental health may be suffering even if they do not have a diagnosed mental health problems. Things such as death or stress, for example, affect our mental health. Imagine having an employee in your company or in an organization who had actually lost a loved one. That is definitely going to affect their mental health. They don't have a diagnosable mental disorder, but their mental health is not good, it's not okay. So that is definitely going to affect their performance at work. Next slide. So mental health is an integral part of health. Indeed, there is no health without mental health. I think one of the things that is also actually obvious that at the moment is for a very long time, mental health has been one of the things that has been neglected. People didn't really think take mental health as serious as they would take physical health. But then, of course, with the COVID pandemic, for instance, that brought in itself a lot of mental health problems, because in most cases, I mean, when it started, for instance, a lot of frontline care workers, they were having anxieties, they were actually afraid that they will actually take the virus back to their families. So that in itself brought the mental health problems. So as a result, it's very important that one's mental health is taken care of. Mental health is determined by a range of socio-economic, biological, and environmental factors. I mean, our socioeconomic conditions are affecting our mental health. Sometimes because of heredity or other biological factors, our mental health is affected, and also environmental factors. That is, for instance, if you think of the workplace environment, the workplace where you are working, the environment itself will really affect your mental health, depending on how suitable it is for the type of job that you are doing. I also needed to bring in the topic of suicide, I mean, which is also related to mental health. Suicide is a complex issue involving numerous factors and should not be attributed to any single cause. So a lot of people attempt or even commit or successfully commit suicide because of numerous factors. It's not because of one single cause. I'm saying this because, for instance, if you think of depression, one of the symptoms that a person with depression would have is the thought of killing themselves or the plan of killing themselves. But it doesn't mean that that is the only thing that will cause a person to actually attempt suicide or commit suicide. There could be other factors that could actually make someone to commit suicide. Not all the people who die by suicide have been diagnosed with mental health illness, and not all with a mental illness attempt to end their lives by suicide. There are those people that are actually diagnosed with mental health illnesses, but they're not even trying to commit suicide. But however, the risk of death by suicide is increased if a person suffers from depression alongside with schizophrenia and other psychiatric illness. So it is important to get treatment for mental illness. Yes, sometimes people are not getting treatment. So because they're not getting treatment, that can actually end up in devastating results where a person is actually committing suicide. So mental health and workplace. Next slide. So the workplace can play an essential part of maintaining positive mental health. Yet it can also be a very stressful environment that contributes to the rise of mental health problems and illnesses. The positive contribution could be, if my work environment is supportive, is providing me with whatever that is necessary that I need to be able to accomplish what I'm doing, that is going to promote the positive mental health. But if I go to a workplace where I'm always knowing that, there are conflicts, I'm not going to be going along with my supervisors or even my colleagues, or I'm actually not having other equipments that actually are necessary for me to be able to do my job, that is actually going to contribute to the rise of mental health problems or illnesses. No workplace is immune from this risk, and we cannot afford to limit our definition to occupational health and safety only to physical. As I said, in the past, the mental health was really not taken very serious. It was only the physical part that was taken into consideration. If you go to many institutions, many organizations, many companies, when they're talking about occupational health and safety, they're only talking about the physical part. You find that, the mental part, the psychological or mental health is actually not taken into consideration. So mental health is just as important and must not be overlooked. It's very important that we also need to actually look into mental health. Next slide. This is also some of the research that I did, or some of the statistics. 2 in 10 employees are unable to work due to mental health problems in any given week. Imagine if you're in a company and you're having, say, about 20 employees, and every week 4 of them are not at work. That will definitely affect your productivity at work, and that actually could be because of their mental health needs, because it's not being taken care of. 1 in 3 workplaces disability claims are related to mental health problems. If people are not being taken care of in a company or in an organization for their mental health disabilities, that can lead to a company having to actually lose a lot of money because of the disability claims that can come out of that. But if that is taken care of, companies would not have to worry about it. 70% of employees are concerned about the psychological health and safety of their workplace. I think I just made mention that when the COVID pandemic started, in the work environment where I work, a lot of frontline health workers were concerned about their psychological health, and as a result, professionals such as psychologists and registered counselors had to, help them in terms of adjusting to whatever that was happening, to the new normal, what we call the new normal. So out of billions of economic costs each year are attributed to mental illness in South Africa, and it stems from workplace losses. So if we don't really take care of our employees or take care of our mental health, there'll be a lot of losses. So that could be one of the consequences of a poor mental health in the workplace. Next slide. Some consequences of poor mental health in the workplace include increased risk of workplace injuries. People might get injured, decreased work performance or productivity, errors that can be made at work, and high turnover rates. Okay. And if there is good work mental, next slide, if there is good work mental health, if you can see with those arrows, the turnover rates will go up, absenteeism will also go up, which is not good, but then the injuries and the grievances will go down. I mean, the people will not come and complain about this and that, because the workplace is very good as far as their mental health is concerned. Many people, I think the other thing that is also very important, next slide, that I think we need to talk about is the stigma. Next slide, please. Many people fear judgment due to the stigma. People are actually afraid to actually come up and say, I'm not well, I've got depression. I need to go and see professionals who can be able to actually give me help, intervention, whether be it medication for me to be able to deal with the depression that I'm having. And that's because of the stigma that I'm talking about. People are afraid that, there can be actually be called many names. They can actually be referred to as being mad. They can be referred them as being pooky. So as a result, people are actually having problems as far as disclosing that is concerned. Stigma is among the primary reasons for which over 60% of people are struggling with a mental illness or other mental health problems where we wish they can actually get help for. But because of the fear of stigma, people just keep quiet and actually not even reach out to be able to be assisted. And then I also thought I need to actually bring in culture as far as mental health is concerned. When I talk culture, what comes to your mind? Well, what do you think about? For a lot of us, we immediately think of what is right in front of us. We think of unique languages, we think of different clothing, we think of diverse food. But a society's culture is also impacts a person's beliefs and norms and values. And it also impacts how you view certain ideas or behavior. In the case of mental health, it can impact whether or not you seek help, or what type of help will you seek, and what support you have around. I'll give you an example. You find that, for instance, maybe having an employee who will come to you and say, what, I'm not well. And when you try to probe into terms of what could be wrong with that employee, the employee could say to you, I need to go, I've got a calling, I need to go to herself so that I could be able to get help. That's very important. Also, when you're looking into mental health, you need to look into that and see how you can be able to, assist your employee to be able to come back and be productive. Of course, I mean, one of the things that you might think of is that, I'm going to be short-staffed, or, productivity is going to be affected, but you need to keep in mind that, that's also important. You need to put that into context, that culture is very important. We're coming from different cultures. Or I can also give you a a very light example where, for instance, an individual has lost somebody, a loved one, and they say to you, can I please take leave so that I can be able to perform some rituals which will actually contribute in terms of making them to be able to cope or to deal with the loss of a loved one. Because if that doesn't happen, it's definitely going to affect their mental health and definitely going to affect their productivity at work. So it's very important that we need to take that into consideration. Next slide. According to research published by the Commonwealth Fund, minorities in the United States are less likely to get mental health treatment or will wait until symptoms are severe before looking. That is also what happens in South Africa. In most cases, you find that, other populations or other races, because we're not taking mental health very serious. Sometimes we think, this is nothing, it will actually go away. We wait until something is very severe, and that's when we start thinking, oh, we need to start looking for help. In fact, only 66% of minority adults have regular healthcare providers compared to 80% of white adults. So you can see the inequalities also contributes as far as our culture is concerned. It is important that we understand that the role of culture plays the role of culture plays in mental health care, so we can support our loved ones and encourage treatment when it is needed. This is also applicable in a workplace. So we need to really support, our employees, our colleagues, so that we encourage them to get treatment, because if they get treatment and intervention that is necessary, they would be able to be productive at work. We would not have situations where there's a lot of absenteeism, or maybe there's a lot of litigations because of, what we didn't do right as far as mental health is concerned. The next slide. Cultural, here are 4 ways that culture can impact mental health. Cultural stigma. Every culture has a different way of looking at mental health. For many, there's a growing stigma around mental health, and mental health challenges are considered a weakness or something to hide. This can make it harder for those struggling to talk openly to ask for help. The one thing that I can share with you, working as a psychologist, sometimes somebody come and see me and I need to write a sick note for that person. And when you have to write a diagnosis, for instance, and say a person is depressed, they feel, when it gets to my workplace, I'm going to be stigmatized. I'm going to be seen as, oh, is that sick one? Oh, she, it's starting again. She is not okay. So as a result, because of that, people are not able to reach out for help. Understanding symptoms, culture can influence how people describe and feel about their symptoms. It can affect whether someone chooses or recognizes and talk about only physical symptoms, only emotional symptoms, of both. Yes, things such as, they will say to you, men don't cry. So you might not actually be able to actually express your emotional symptoms. And as a result, people around you, even at the workplace, they might not actually be able to realize or identify the symptoms that, you might not actually be doing well as far as your mental health is concerned. Community support. Cultural factors can determine how much support someone gets from their family and community when it comes to mental health. Because of existing stigma, minorities are sometimes left behind mental health treatment and support alone. Yeah, because of the stigma, as I've mentioned, even in the communities, you find that we are actually hiding those that are actually having problems as far as mental health is concerned, because we are afraid of stigma. Resources also. When looking for mental health treatment, you want to talk to someone who understands your specific experience and concerns. It can sometimes be difficult or time-consuming to find resources and treatment options that take account into specific cultures, factors, and needs. That's true. Sometimes you find that you feel comfortable talking to somebody who is able to understand your culture, and sometimes it's very difficult to be able to get to that. Next slide. There are only a few ways that culture can impact the perception of and treatment of mental health. Every culture and person is different and face unique journey to recovery. So we need to take that into consideration. You can help address the mental health of minorities by understanding the role culture plays in mental health, and by becoming trained to help those around you Of course, I mean, if you are aware of something that know that the people around you are not aware of, you can be able to train them so that they can be able to identify if they are not really doing well as far as their mental health is concerned. So that's very important. So that will actually encourage them to be able to get proper and appropriate treatment. Next slide. The next slides are going to be talking about the management of occupational health and safety, that is the psychological risk. So I'm going to talk to you about 13 factors that are very important as far as mental health in the workplace is concerned. The first one is organizational culture. I'll also talk to you about the psychological support, the clear leadership and expectation, civility and respect, psychological competence and requirements, growth and development, recognition and reward, involvement, and workload management, engagement, balance, psychological protection, and protection of physical safety. So these 13 factors are very important as far as the mental health in the workplace is concerned. But I'll go through them one by one so that we can be able to understand how if we take into consideration these factors, we can actually be able to have a good mental health care environment in the workplace. The next slide, the organizational culture. Can you move to the next one? That talks about the organizational structure. The workplace is characterized by trust, honesty, and fairness. The basic assumption held by a particular group. This is a mixed of values, beliefs, and meanings and expectations. If you go to a company, if you go into an organization, there's a mixture of values and beliefs and meanings and expectations. So the culture must be very organized. Organized trust is essential for a positive, productive social position within any workplace. This is a predictor of cooperative behavior, organization, commitment, and employee. If there is the culture of organization in the company, there'll be a lot of commitment. Employees will cooperate and employees will be loyal. A culture with social support enhances employee wellness. If they are supported at work, they will be well as far as their mental health is concerned. And an unhealthy culture creates more stress, which lowers employees' well-being. And if the employees' well-being is lowered, then we'll have problems. The next factor is psychological support. What happens when psychological support is lacking? Next slide. When psychological support is lacking, there will be increased absenteeism, withdrawal behavior. There'll be a lot of conflict at work. There'll be a lot of strain. People will actually feel that, there's a lot of strain at work, which can lead to fatigue, headache, burnout, and anxiety. There's also a lot of turnover, loss of productivity, increased cost, and greater risk of accidents and injuries. So what I'm trying to say is, as far as mental health is concerned, or good mental health is concerned, that we're supposed to have good psychological support at work. Okay, next slide. Clear leadership and expectations. In an organization or company, there need to be clear leadership and expectations. Workplace where there is effective leadership and support that helps employees know what they need to do, how their work contributes to the organization, and whether there are impending changes. That's very important. If we have that in our organization or a company, that's very clear. So as a result, employees will be able to know what they're supposed to be doing and when they is expected to actually make changes. If there is clear leadership and expectations, this will increase employee morale, it will increase their resilience, it will increase their trust, and decrease employee frustration and conflict. And it will result in high job wellness, reduce sick leave, and early retirement. Because sometimes people retire early because they feel, in this company, in this organization, things are not clear, the expectations are not clear. So as a result, they might actually even end up taking early retirement. Next slide. Civility and respect is also important as far as the mental health is concerned. A workplace where employees are respected and considerate in their interactions with one another. If you are in a workplace and you get that, everybody is considerate and they're respecting each other, you find that, the mental health will also be very good. A civil and respectful workplace is related to greater job satisfaction, greater perception of fairness, positive attitude, improved morale, and healthy mental well-being. And if there's a lack of civility and respect, that might actually end up in emotional exhaustion, conflicts, grievances, and legal risk. For instance, an example of a workplace where there is no civility and respect is where you find that maybe the supervisor or a manager or a boss is bullying other people. So that can actually result in conflicts and grievances and costing a lot of money to that company. Next slide. Psychological competency and requirements. A workplace where there is good fit between employees' interpersonal and emotional competence is what we, I mean, every workplace should actually have a fit between the employees' interpersonal and emotional competencies. So it means the worker here possesses technical skills and knowledge for a particular position, as well as the emotional intelligence to do the job. And by emotional intelligence, I'm talking about things such as self-awareness, being able to control your impulses, persistence, self-motivation, empathy, and social skills. Those are very important as far as the mental health or the good mental health in a workplace is concerned. So if there is a good fit between the psychological competencies and requirements, next slide, you find that there is fewer health complaints, there is lower levels of depression, there is greater self-esteem, there is positive self-concept, there is enhanced performance, there's job satisfaction, and there's also employee retention. So it's very important that we do take into consideration that there should be a fit between the psychological competencies and the interpersonal requirements. If there's lack of that, next slide, if there is lack of psychological competencies and requirement, that results in job strain, emotional distress, provocation, excessive dwelling on thoughts, defensiveness, energy depletion or poor productivity, conflict, and lack of enjoyment and engagement. And that's not very good for the mental health as far as the workplace is concerned. All right, the next slide. Growth and development. That's also very important. A workplace where employees receive encouragement and support in the development of their interpersonal, emotional, and job skills. It means, it's a very good place where, the mental health of the employees are taking place. If there is this growth and development, that will increase goal commitment, it will increase organizational commitment and job satisfaction. And skill acquisition and career development enhances employee well-being also. Hence, I'm saying it contributes to the mental health, with the good mental health of employees. If there's lack of growth and development in a company or an organization, that will lead to, employees being bored at work, the well-being suffering, a lot of conflict, there'll be a lot of disengagement, there'll also be a drop in performance. Okay, next slide. So a workplace, the recognition and reward, this is also important. In a workplace where there is appropriate acknowledgement and appreciation of employees' effort in a fair and timely manner. If you're having recognition and reward in a workplace, this will lead you to motivate employees, it fuels desire to excel, it builds self-esteem, and it even enhances the success of that organization or that company. But if there's lack of that, lack of recognition and reward, the employees will be demoralized, they'll be burnt out, there'll also be a lot of emotional distress, and that is actually going to lead to a lot of financial losses as far as the company is concerned. Next slide. Involvement and influence. That's also very important as far as the workplace environment is concerned. A workplace where employees are included in discussion about how their work is done and how important decisions are made. If the employees are actually working in an environment like that, there'll be high morale, they'll start engaging, they'll have pride in an organization, and that in itself would increase their psychological well-being. But if there's lack of involvement and influence, the employees will end up being distressed, there'll actually be a lot of job alienation, cynicism, and they'll also end up being burned out. And that's actually not going to contribute to the mental health the good mental health in the workplace. Next slide. Work management, that's also very important. And sometimes we take this for granted. We don't manage the work in a way in which we're supposed to be managing it. A workplace where task and responsibility can be accomplished successfully within a time available. So the work needs to be planned so that things are accomplished in the time that is actually planned for. If there's lack of work management, this leads to increased demand. It leads to physical, psychological, and emotional exhaustion because I think the president, when in his opening statement, he mentioned that he was talking to a colleague who was still at work at about 7 o'clock and all those kind of things. I mean, that's in itself will lead to emotional exhaustion. But of course, they're not doing it by choice. They're doing it because, the pandemic has affected a lot of things at work. But if it's managed appropriately, we will not actually have a lot of that. Okay. Engagement is important for individual satisfaction and psychological health because it leads to increased profitability for a company, greater customer satisfaction, it enhances task performance, there is greater morale, and there's also greater motivation. But if there's lack of engagement, that can lead to negative economic impacts, psychological and medical consequences, workplace deviance, and counterproductive behavior. So it's very important that employers, supervisors, and employees, they need to engage each other so that they can be able to, achieve the good mental health. And as a result, the company will benefit from that. Next slide, the balance. There need to be balance as far as the work environment is concerned. If it's present in a workplace, if there is this balance is present in the workplace, there is a recognition of the need for balance between the demands of work, family, and personal life. Employers need to recognize that their employees have got multiple roles. They are providers, they are fathers, they are mothers, they are brothers, they are uncles. So as a result, they need to actually take that into consideration because if they don't do that, what will happen is, if they do that, if there is a balance and they are recognizing their debt, that will make employees feel valued. It will reduce stress. It will enhance employee well-being and commitment and job satisfaction. But if there is no balance, as far as recognizing that employees have got multiple roles is concerned, the health and well-being, they will start feeling that their health and well-being is undermined by accumulating home and job stress. That will lead to high job stress resulting in dissatisfaction with work and absenteeism due to physical and mental related problems, and increased costs due to benefit payouts, disability, and turnover. So it's very important that there should be balance as far as work is concerned. Lastly, I think we've got psychological protection. The next slide. This is demonstrated when employees feel able to put themselves online and ask questions and seek feedback and report mistakes and problems. If you've got employees that are able to actually do that, it means they feel protected psychologically. A psychologically safe and healthy workplace actively promotes emotional well-being and minimizes stress to employee mental health. And it leads to job satisfaction, increased morale, fewer conflicts and grievances, and liability risks. Okay. And next slide, protection of physical safety. I think as I had mentioned, I think previously, in most cases, if you go to a different organization, their health and occupational safety is only focusing on physical safety, but that's important. I'm not saying it's not important. It includes the work environment itself. How is my work environment? Steps can be taken by management to protect the physical safety of employees. This can be done through policies, through training, through appropriate response to incidents, and demonstrating concerns for employees' physical safety. Sometimes we don't really give ourselves time to be able to ask our employees how they are, physically and all those kind of things. And that in itself doesn't demonstrate that you actually are concerned about them. It's very important that we need to actually look into that. I also need to say to you, this is not only the work that is actually expected to be done by managers, supervisors, or employers. The next slide, I think all of us are actually playing a role as far as our mental health is concerned. Employers, what are your roles? You need to provide information. You need to give instruction and supervision to the employee to protect their health and safety. That's very important. You need to take precautions reasonable for protection. You need to prepare and review the occupational health and safety policies that you are having. Though that is the responsibilities of the employers as far as the mental health is concerned. Supervisors, what are your responsibilities? You need to ensure that employees work in a manner and with protective devices or measures and procedures. That's very important. You need to advise the employees of the existence of any potential or actual danger to the health and safety as far as their workplace is concerned. And where prescribed, you need to provide employees with written instructions on health and safety. And what about employees? You also need to play your role here. You need to comply with the policies and regulations on occupational health and safety. You need to report defects to the supervisors. You need to report any contravention of occupational health and safety regulations, because if you don't do that, at the end of the day, it's really going to affect your mental health. It's really, really very important that each one of us play a role as far as the mental health or the occupational health, including mental health, is concerned. That's very important. And I thank you. That's the end of my presentation.
Thank you very much, Mr. Thank you very much for such a detailed presentation. I wonder if our members were a whole lot, and majority of them were also asking on the side that will they be able to get access to the slides so that they can be able to read by themselves when they're sitting, whatever, on their own. Because there's a lot to absorb on whatever it is that you have said. All the topics that you have touched can be topics on their own, you know. But at the present moment, we're not going to deliberate more on the issue. I know people might be burning to ask you certain questions, but I want you to jot them down, colleagues, as we are going for the Deputy President to be the one who comes and give us at least a presentation, and then we'll be able to go for question and answers immediately after the DP is done, so that we can just make sure that we have a round type of questions and for both of them. DP, thank you very much for giving yourself time and for accepting our invite. I'm going to give you this opportunity to just have prepared. Thank you very much, DP.
Thank you, Paul. Thank you, Mr. Mugodi, for an indeed very detailed, well thought through, well prepared presentation. I would also like a copy of the presentation just to keep for reference, as the other members have asked. Good evening, colleagues. My name is Isetu Mangotjwa. I am the Deputy President of the BMF. When my colleague Umpo was discussing this topic, we were discussing it a few weeks ago, and I said that, you know, I would like a session that I could contribute to discuss what I think is a very, very important topic. I'm going to not speak for long, just because I know that evenings are family time, really, and I do respect that. I think my talk really is in two parts. The first part is about my own personal experience, and the second part is about how we need to heighten our awareness as leaders in any environment, whether it be at work, whether it be in the BMF, in any of the environments where you lead. So I'll start with my personal experience. So in 2015 or 14 or so, I experienced some personal challenges, and I think I experienced the personal challenges for a significant amount of time. And what I learned was that you can have a certain aspect that stresses you, or something that causes you stress, and that can be in the normal course of life, because life does have certain challenges. But what I learned later on in my journey is that my particular stress and stressful situation was just there for such a long time that it went beyond the regular day-to-day stresses. And it actually then developed into like a clinical depression. So I think the one thing that, the first thing that I'd like to highlight is you should try and not have something stressing you and you either don't get out of the situation or get some form of assistance for an extended period of time. Now, I'm not speaking from a medical perspective, but I'm speaking from my own personal experience. And I think when I realized that I needed help and that I was indeed depressed back in 20, I think it was 20, between 20, maybe 12 and 2014 or so, was what I experienced was that just getting out of bed in the morning was really, really difficult. From the moment I woke up, I felt a sense of anxiety. I felt a sense of just being overwhelmed by life. I felt like everything was just too much. So for me to wake up, make my bed, shower, dress, by the time I got into my car to go to work, I was exhausted. And it felt like such a huge effort. And the fact that I still had then a whole work day ahead of me added to the sense of just being overwhelmed and just being completely anxious. So life almost became, I would call it unmanageable, because I was in this constant state of anxiety and just feeling overwhelmed. The second thing that I experienced was just a lack of energy. I was always tired. It didn't matter how much I slept. So this is the kind of dichotomy or contradiction that you'll face, is you can barely sleep because you're feeling stressed, your mind is racing, you're feeling anxiety, your heart is beating fast, you're feeling sweaty, you don't know whether you're hot or cold, so you struggle to sleep. But then in struggling to sleep, you are always tired. So that's the contradiction. So you would think that if you're always tired, you would be grateful to get some rest, but it doesn't actually work like that. It's very difficult to actually switch off and to get some rest. The other thing I started feeling was I didn't enjoy the things that I used to enjoy anymore. I got to a point where I didn't know what I enjoyed. I couldn't tell you like what I feel like eating, where I feel like going, what makes me happy. I couldn't even remember. The things that used to make me happy and bring me joy didn't bring me joy anymore. It was almost like nothing could, I mean, I could win something, you know, and somehow the level of depression that I was in, my emotions couldn't connect to the positive things that were happening in my life. So somebody looking in would have thought that I had it all. I was a young chartered accountant. I had this nice car, nice apartment, and all of that. But none of that. It was as if I was having an out-of-body experience, as if all of these things were happening to somebody else. And I just felt the sense of deep, deep unhappiness. Like the way that I used to describe it then was that it almost feels like the whole world is colored in a dark color, like a gray color. So whether the sun is shining and it's the most beautiful day, to you, it feels like it's an overcast day, maybe it's raining, the clouds have gathered. So you are just in the sense of darkness, if I can put it like that. The other thing I experienced was my memory became quite bad. I couldn't remember stuff. My mind would just draw a blank. And that affected, and this I think speaks to some of the aspects that Mr. Mokoti spoke to, that affected me at work, because at work, you need to remember, you need to remember what you've been tasked to do. You need to remember how to do it. You need to do it efficiently. You need to have the energy to deliver and deliver on time and deliver well. And the role that I was in was very demanding. And all of a sudden, it was like I couldn't do the things that I previously could do, like second nature. And I would just get stuck. And within that being stuck, it would then add to the feeling of overwhelm and anxiety. So it was just a vicious circle that just, it took and for me to actually seek help, to actually get an intervention on that. So I'm just trying to highlight some of the signs of when your depression is not just like, I'm just having a bad day, or I'm just facing the normal challenges of life. So it's the overwhelmed feeling, it's the lack of sleep, it's the heart palpitations, it's memory loss, and kind of forgetting how to do the things that you'd normally do, especially cognitive things that require your brain and require you to think and require you to be creative, that I totally lost. I think for me, those were the symptoms. And when I sought assistance and help from medical professionals, they came to explain to me about, this excessive stress for excessive periods of time can actually cause a chemical imbalance in your brain where the hormones, I think it's dopamine that they often refer to. Baba Mukoti, you can always correct me. It's like your reward hormone. And by reward hormone, what is really meant is that it's the hormone that makes you react positively to positive things that are happening in your life. And when now you've been under stress for so long that that hormonal imbalance has now taken root within your brain and within your system, your dopamine is suppressed. And that's why I got to learn later, I couldn't feel happy about all the positive things in my life, because simply my happiness hormone or my reward hormone, that response was just simply not there. How I really got out of it was, I learned a saying back then. I don't know where I heard it, but it settled within me, and it forced me to take action. And it was a saying that says, nothing changes if nothing changes. And I realized that if I didn't get out of the situation that I was in, it didn't matter what, seeing a therapist or whatever support mechanisms that I was getting were not actually taking effect, because my situation wasn't changing. So number one, it took me actually changing that situation and taking certain difficult decisions to get out of the situation that I was in. Number two, of course, it was the help. And I think Mr. Mukoti said that we need to destigmatize these things so that people are not afraid to get help. So I was fortunate because my mother's a medical doctor, and she got people around her to assist me. And I don't know if I would have reached out to those people without her, but there are always people around you who can connect you to people who can assist you. So I want to reiterate what Mr. Mukoti said, that never sit alone feeling these feelings and not reach out to anybody. You'd be surprised at how many people have actually experienced anxiety and experienced depression and experienced these things that we label mental illness so that it makes us feel ashamed of them. But actually, it's so prevalent, and it's so important for us to destigmatize them and start speaking about them. And that's why I do speak about my experience, because I want people to know that, number one, it doesn't just happen to other people. I know as Black people, we often think that these are white people things. And I think that is to our detriment as the Black community. And when Mr. Mukoti was putting up the stats, you will see that that's why our percentage of adults in minority, well, we're not a minority in South Africa, but I suppose non-white populations would be much less willing to reach out and seek help, because these things are still stigmatized in our communities. So part of me coming onto this platform and sharing my own story is part of destigmatizing this issue, and to say that it can actually happen to anybody. And that there are support mechanisms, and that there are people that you can reach out to. So I think that's the first part. And I think in my recovery journey, yes, it was seeking that medical help, seeking that therapy, changing certain things about my life that were keeping the stresses, that were keeping the stressful situation the way it was. It just wasn't changing. But then when I really started my recovery journey, I focused on the most basic of things. And I said to myself, if you can just sleep well, eat well, exercise, and stay hydrated and drink water, which is part of sleeping well. Those were literally the baby steps that I had to start at. But that's probably because of the extent of my own depression. Some people obviously don't get there, and it's advisable not to get there. I literally had to almost rebuild myself, my confidence, my energy, my physical, because it also affects you physically. It's not just mentally and emotionally and psychologically. So that's what I did, and I think I'm really blessed to have been able to rebuild my life as such, and to be able to stand here and tell the story, and that I'm not ashamed of, actually, because I think it will benefit so many people to know that. You know, somebody like me who people may look at and perhaps feel or admire and put on a pedestal, and to know that I've overcome this, and you know, I can talk about it, and we need to completely destigmatize it. And in order to destigmatize it, people like me need to actually start talking about these things. Then the second thing I wanted to talk about is, as a leader in society or in the BMF or at work. I'll give you an example. I've got a lady at work who lost her husband, and she lost her husband even before I joined the company. But when I joined the company, I wanted to meet everybody in my team, and I didn't just want to know what they did in the company, but I wanted to know more about them and their families, and just more about who they actually are. And this lady shared with me in our very first meeting that she'd lost her husband to COVID in June last year. And that gave me an insight that in my interactions with her, I already know enough about her to know that she's still battling with the loss of her husband. And so a few weeks or months later, she had and I'm going to use this example just to heighten our awareness, guys, as leaders. She had a situation where her geyser burst at home, and she was so emotional about this geyser bursting, and the guys came to fix the geyser, but then when she checked the water later, the water was still cold, which meant that they didn't fix the geyser properly, and she like literally just burst into tears in a meeting. And for me, I immediately knew that it was not about the geyser as much as it was about the fact that her husband had died, and he would normally deal with the geyser guys, and now she was having to deal with the geyser guys, and it was more the loss that was making her so emotional about this whole thing. And so I think I would like to almost appeal to us as leaders to get to know the people who we lead, not just about what do you do, or you need to deliver this to me, I want to know what you do, how to do it, and when I can expect deliverables from you, but to really take time to get to know people. Because I personally don't necessarily buy into this thing that when you go to work, you're a machine, you leave your emotions at the door, or you leave your emotions at home, you leave your issues at home. And I mean, I think that's been drilled into us for many years, but I don't actually buy it. I think that people come to work carrying all of that, but because people are professional, they know to kind of compartmentalize. So people compartmentalize. They don't leave the emotions at the door. They don't leave the fact that their child is sick at the door. They don't leave the fact that they've lost their husband or their brother or their mother to COVID at the door. That's not possible, in my view. And I'm obviously not a professional, but I genuinely believe that. And so it's important for us in our interactions with people, and particularly when you're in a position of leadership, just to get to understand the people you work with on a day-to-day basis, understand who they are, where they come from, have just chats with them, so that when these emotional outbursts or anything happens, you kind of already have a sense of the human being, rather than the employee who owes you deliverables on a certain day. And I'm not by any means saying that we need to not be professional, we don't show up at work, we don't deliver, we must be crying and babbling all the time, no. But I want to change this narrative that we are these machines from 8 to 5. because I don't think it's a reality. And so I think without taking a lot of time, those were just the two aspects that I wanted to share. And I hope that me sharing my own story will help somebody who is battling to, number one, not feel like stigmatized, not feel ashamed, or to feel alone and feel like this shouldn't happen to somebody like me. And I really, that's just what I wanted to share with you guys this evening. So thank you very much.
Thank you very much, DP. Look, when we had our conversation prior to organizing this webinar, I remember we had a heartfelt type of a conversation where you told me the same story you are telling, which now you went into detail. But I just want to indicate to you about what you just did now. There's one who just wrote and say, thanks DP for sharing your experience. It is selfless if you and you are contributing to mental health awareness a great deal. You are helping squash the stigma, and thank you, DP. Your story goes a long way, DP. It indicates, one, that I know you as a super achiever, one of intelligent women that BMF has ever had. But that indicates with your story that anyone can have mental illness, and somehow we need to really take care of ourselves as leaders, as managers and executives, as also Mr. Mokoti has mentioned, to say, even those ones who are managers, you must know that you are not excluded from the people who can be affected by these things. So much so that because you have so much pressure, you are the one who's in charge of this, you are a captain of an industry. So all the burdens and all the buck stops by you. So you are bound to have so much stress, but I'm happy about your emotional intelligence that you have, and also the resource that you also have. So I'm very happy about what you have just said. Just to set the tone, Mr. Mokoti, can you come back? I want us, DP, just for you to tackle this question as Mr. Mokoti is coming back. How do we balance our life, DP? Because the work-life balance, it's not easy when you're holding a position as big as yours. You've got kids that you need to take care of, that need your attention. They don't care that their mother is a CFO somewhere. They want their mother. And somehow you've got a husband that needs the wife. You don't need the manager who comes at home. They need a wife. How do you balance these two things, and how important it is to balance this work life, that this is my work and now this is my family that I need to take care of, and I need also leave more than that, How do you balance that? And as I'm going to come to Mr. Mokoti with other questions and allow colleagues, we have open for questions now, engagement. You can write them down. You can also come in with a voice. Over to you, DP.
Thanks, Mpo. I think this is something I get asked quite a lot. And there's a couple of aspects that have made me able to cope. I think I read I think you all know, one of my favorite books is Lean In by Sheryl Sandberg. And one thing that she taught me in that book is that you can have it all, or you can do it all, whichever word you use, but not at the same time. So there's this finite resource called time, right? So I always make an example that when I was doing my MBA, I effectively had 2 years where I knew that, at Gibbs, you can choose certain structures. Some people attend in the evening, some people attend 2-week blocks, some people attend whenever. So my block attended on the weekends. It was every second weekend, something like that. But you would start the whole of Friday, the whole of Saturday, and the whole of Sunday. And so for 2 years, I had like half the weekends of the year, I was not available for my kids, for my family, for all of those things. The thing that helped me, because that's a good example of when, things were really hectic, Number one, I have a very supportive husband. He picked up the taking the kids to parties and taking them out for an outing on weekends and entertainment and all of that. He was very good with that. And I would do it on the weekends that I was home or that I could. But he was very good with that. I have a helper at home who lives with us, who is also very, very, very good. So she takes a lot of pressure off of me and allows me to do all that I do. So those are the support mechanisms for me that really helped. But I also think mentally, so as women, I know particularly, I can only talk as a woman, we suffer from guilt, so I could say, yes, my husband's doing this, my helper's doing this, and so I can spend 2 years at gigs. But in my heart, it could be killing me that I'm missing 2 years of, my kids' sporting activities or whatever it is. And for me, what helped was to be at peace with the fact that I'm going to be away for this time, to look at it to say, I am bettering myself, I'm doing something, I'm filling up my cup, because it's something that I wanted to do for me. I didn't have to do an MBA. It's not like your junior qualification where your parents are pressuring you to finish university. So it's something that I decided that I wanted to do. And so because I was filling my cup, I knew that later on I would be able to then pour that back into my family. And indeed, when I finished my MBA, I had a lot of time to spend with my family. And also not to discount the fact that, it then assisted my career, and a lot of things. So even in the sense of, if you get a promotion after your MBA, well, that means that you suddenly have more resources that you use for the benefit of the same family. So I think as women, we give a lot of ourselves. And so for me, I didn't take it as, this is a very selfish 2 years that I'm taking. I said to myself, the benefit that I get out of this, the uplift, whether it's in my job or career, whatever it is, and my happiness and my sense of fulfillment, actually, I will pour it back into my family. And so I always say, for me personally, if I'm chasing a deadline this week, I'm probably not going to be home at 5 o'clock. I'm probably not going to help my daughter with homework. I'm probably not going to be chilling, watching Gomorrah with my husband at 7:30. But it's okay, because when I've met that deadline, I then pour back and I tip the scales the other way. And I pour back into the cup so that over a period of time, I have balance. But I kind of came to peace and completely disposed of the idea of having balance at the same time. So I'm giving 25% to gym, 25% to my husband, 25% to work, and 25% to my kids all the time. I came to peace with the fact that I'm never going to be able to do that. But over a period of time, I do find balance. So if I've been busy with BMF, I'll go to next weekend, we have to be in Cape Town for the BEAs, that's fine. Because the following weekend, I will make sure that I don't book myself things and whatever, and I will spend the entire day with my kids. I'll take them to Gold Reefs. I'll do whatever they want to do. And that then brings back that joy for me and sense of fulfillment for me. So that's how I manage it. It's ebbs and flows. It's peaks and troughs. It's not going to be the sense of balance all at the same time. It doesn't work like that. And I think for me, when I came to peace with that, it made my life a lot easier, because I think as women, the one thing that we don't talk about enough is the guilt that we often feel when we are pursuing our own dreams and taking that time away from our families and our husbands, etc. So that's how I cope, Paul. You're on mute, Mpho.
The brilliant. Thanks, DP. I think a lot of people confuse this balance to say this balance means you must do 50% this side and 50% the other side. And in most cases, you find it cannot work. But I'm glad about how you are balancing it. Mr. Mkoti, let me just bring you into the picture now about Look, I just like, sometimes with psychology, there are bigger words that are there and that are very clinical, which we normally get. And so I want us to go to elementary explanation that is very simple in terms of what is the difference between stress and depression. In most cases, people interchange these words, and sometimes I'm stressed and I'm like, I'm depressed. And sometimes I'm depressed, I'm like, I'm stressed. So we don't even know what actually this is. And I think DP said a whole lot of things about what clinical depression is and the symptoms has to do with it. But I want us to just go to that. And after touching that, Mr. Mkoti, I would also like you to touch on issues related to you find I am a friend, and I know of some of the other people or my colleagues that they might be undergoing what DP has mentioned, or maybe even more. And I've seen that as we are busy with the presentation and the presentation that you were just giving now, I'm realizing, oh yes, man, some of my colleagues is sick about 1, 2, 3. I'm suspecting this and that. I want you to also touch the issue of how to become a very supportive friend, on the layman language, on a very elementary explanation, where you are going to become a very supportive one. I'll tell you why I'm saying that. I was speaking to one of my colleagues, and we are highlighted the issue that happened. Who's this? Black Coffee, when he was speaking in the funeral of who's this guy who just passed away now?
Rick.
Rick, yes. That Black Coffee mentioned something related to. I was trying. Rick reached out to him, and after reaching out to him, and Black Coffee was returning to him to say, "Now let's meet." Then Rick decided, to just run away and scorn him, make sure that they don't meet until the devastation has happened and whatever has happened. The issue there as a supportive friend, what is it that you need to do when you are a support and you find I can see there are issues with my friend, but when I'm busy chasing him or her, I can't be able to get hold of them somehow. What is it that I can do? What are the other mechanisms that you think we should do as you touch on these two things? What is the difference between stress and depression, as well as that, Mr. Mkoti? Thank you.
And thank you very much, Mr. Mutai, for the two questions. But before I start answering your questions, I would like to thank the DP for sharing her experiences. That is very brave of you to be able to do that. And I think it shows that you yourself, your mental health is actually very good. You are psychologically supported. You actually didn't feel that, if I go and share this on this platform, I'm going to be judged or people are going to stigmatize me. I think that's very good, and that's actually where we're supposed to start, as far as making sure that we do destigmatize the issue of mental health problems. So that's actually very great. And I think you also, touched on a lot of things when you were talking about that. I think one of the things that I need to just also add to what she said before I answer questions, I'm hoping I'm not wasting other people's time, is she spoke, when you ask her about balance, I think there's an issue about individuals thinking they are superhuman beings. You are not a superhuman being. It's true. You've got multiple roles that you are playing. It's true. One of the things that I do, which is actually something very simple, when I get home, you see, I'm actually wearing a tie. One of the things I do when I get home, I make sure I actually take this off and actually put on my shorts or everything. That in itself helps me to be able to switch my mindset in terms of realizing you are not a psychologist in here. You are a dad now. You are a husband, and you actually need to be able to be taking care of other things that actually needs you. That helps me a lot in terms of balance. And I think if one is able to do that, even in a workplace, you're also able to actually realize that, you know what, your employees are also having multiple roles, and there's also multiple stresses that can actually make them to be not well enough. I just would want to end it there as far as just adding to what GP said. And coming to the difference between stress and depression. Stress is a word that is loosely used. You are right. It's actually a layperson as word to use. Depression is a clinical term. When you say somebody has got depression, that needs to be something that was diagnosed by a professional, which some of the symptoms GP spoke about, to say, you know, I experienced a depressed mood, I experienced lack of energy, I was feeling helplessness, I was having problems with memory, I was not enjoying things that I used to enjoy doing, I was feeling sad, some of the people will even have thoughts of killing themselves. Then that we will call a clinical depression. In most cases, that is supposed to be diagnosed by a professional, either a psychologist or a psychiatrist. They could actually be able to say, this is depression. So the difference is we use the term stress very loosely. Then, for instance, if I see a patient, the patient will come to me and say, I have stress, and I'll ask them, what do you mean you've got stress? And they'll start actually giving me all the symptoms that will actually be able to actually say to them, actually what you're having is depression. So that's the difference between stress and depression. Depression is something that is supposed to be diagnosed by a professional. Your second question was about social support, as far as supporting a friend is concerned. And I think I had mentioned that, you know, as individuals, sometimes we think we are super individuals. I think one of the things you always need to remember, I mean, you are a friend, isn't it? You are not a psychologist or a professional to that person, for that matter, even if you are a registered counselor, but that person is coming to see you, to talk to you as a friend. And the example that you gave you of black coffee, I think the fact that when they were supposed to meet and he could not be able to do that, that's actually a sign. I think one of the things that one needs to do as a friend, when you realize that maybe I'm not going through this person, is to try and mobilize support. Try and find out who else is there that could be able to support this person. If I'm a friend, I'm probably maybe seeing you maybe in social interactions or social gatherings, but then who are you staying with? And you need to try and find out and actually try and alert those support systems to say, you know, I think having to notice any, you know, change in behavior as far as, you know, your friend or my friend is concerned. And they might be able to also be some of the people who would be able to support this friend and maybe eventually even encourage or encourage the friend to be able to go and seek professional help. Because as I'm saying, that is your friend. Try and look at mobilizing the support system around him, because you're always not going to be there. Try and check who else is there that can actually be able to support or maybe listen and hear what they're saying and lead them to be able to get professional help. I hope I've been able to answer the questions.
Yeah, thank you very much, Mr. Mkuti. I think that's great. I'm going to go to the audience, Dr. Vuyo Yokwe. I'm going to give you an opportunity to ask a question. Just be as precise as possible. We are behind time. And after that, I'm going to read the questions that I also see here. They are not a lot. I think I've got 2 questions. So Dr. Vuyo, would you mind to just mention your question, please? Dr. Vuyo?
Thanks a lot, Mr. Paul. So I'm a medical doctor. I suffered from depression, and the one thing is that I did not do is to seek for help. There were lots of psychologists around me. I admire DP for what she did. So for me, what happened was, in the workspace, my mother came in and she went straight to my CEO and she said, listen, And she said she shared sentiments that I am not about to lose my child under these circumstances. The way I was so embarrassed, right? And so to find a safe space is very difficult in the workspace, and you know, our workspaces don't have those provisions. And I was so surprised to hear DP speak so frankly about her story. That's what I started doing. I on Monday was speaking to Metro FN and February, and lots of people were so surprised that, oh wow, you're telling us that you went and had problems with alcohol and so on. I think that this is the innovative way to help to have our society today, which has got a lot of these digital spaces happening, to have people like DP and people like you know, the high profile individuals of society to start speaking out. Imagine it's already happening now for BMF. Imagine us as clinicians collaborating with people in the leadership and also in the social advocacy videos, so voices. By the way, I also am linked now with Mr. Silo Makekangcobe, and before his friend passed on, you know, we started sharing, you know, discussing a conversation, but this one now is focused to men who don't speak up at all. And I think it's even so rife in the workspace because they become the ones who affect the next people, because they are the leaders that affect the next people that they deal with. They're hostile, they start bullying, they start getting lethargy, they start having abusive languages, because then they're told that the only way for you to remain strong is to use your aggression to mark your territories. Now, my question to BMF really is that when do we start collaborating with these people, social advocacy voices and leaders, to say that once DP speaks, every other people then will say that, you know, I relate, and therefore I now it's fashionable for me to speak about mental health even at work. Also on the men's front, actively find people who are willing to speak like DP. And you know, even myself, my story is well documented now with many people who follow the work I do. So we need that collaboration. It's the innovation. I understand that, you know, Mr. Mukwati, thanks a lot for the presentation that you gave, and the mitigation space, you know, factors that you can put on that were presented, and the recognition and reward, involvement and influence, they mitigate really the depression or the stress in the workplace. But now to go straight to say that those people that, so if you can't mitigate it, those who are stressed, the highly stressed or under a lot of depression, how then do we make them to be able to beat the stigma and, you know, get to disclosure and hit the culture stance around depression? So I would really also love to talk to BMF to talk about the work that we're trying to do. And so the question really is, how do we then collaborate with those people, the social advocacy voices, and admiring that best model that DP has given. So that's my input.
Thank you very much, Dr. Vuyo. DP, I think how does the BMF collaborate with organizations like that? And Mr. Mukoti, I think quickly after DP, you just touch on the question that he also asked in terms of the stigma part and all those things. You just touch on it. And then I'll go straight to the chat and read the questions. And then Ms. Rapodu Tulamsindo, my deputy chair, will come after that. Thank you very much, DP.
Doc, I think the answer is very simple. You just start. You do something. The more we ask, when Dr. Yokwe, how do we do it? The more we're going to postpone actually doing it. So for example, now you would know that this is something that I'm passionate about. And fortunately, I am in the leadership of the BMF, and you are welcome to reach out to me and we can craft something. And that's how you do it. You start, you start even if you're not sure how and when and how and whatever, but you start, and then it builds momentum. And we could actually have, whether it's a conversation series, and we build from that, and we find support mechanisms, and we partner. But for me, it would be about just taking that first step, and you'd be amazed at, what comes out of it. And I'm willing to avail myself to craft how those partnerships can work. Thanks.
Yeah, I'd love that.
Thank you very much. I think, DP, what you're saying is very crucial. We have taken a drive, maybe you might have seen on my statuses as well, about awarenesses about these issues of mental health, moving around with the community radio stations. I'm doing it deliberately for the community radio stations, but we also brought it in the BMF. Dr. Vuyo, we have started already. Hence, we have this type of a topic in the BMF. It's not really a traditional type of topic we have, but we realize that it's very important. We have started, I think, just get hold of DP, and we started from there to see what we can come up with. Mr. Mkoti, can you tackle the second question, and then I can go to the chats, and then we can go to Lamsi. You are muted, Mr. Mkoti. Can you please unmute?
Oh, thank you very much. I also wanted to say to Dr. Yope that, now that you're saying, how are you going to actually be involved in stakeholders? I would like to maybe let you know, in the Department of Health, actually Limpopo, we actually had started with a program that we call #Be Kind to Your Mind. And that is aimed at going to communities and actually talking to them about, how to take care of themselves, talking to them about mental health. And when we do that, we actually go with people who are actually going to talk about their experiences as far as mental health is concerned. And that in itself encourages other people to actually start realizing that, having a mental illness is the same as, having flu, and it can actually be treated, it can be controlled. And we're getting a lot of positive response from a lot of people who are actually not talking about their illnesses, and so they are coming out and are actually being able to actually talk about that. And the other question that you asked was, how do we make them to talk as far as the stigma is concerned? Remember, mental health has always been thought of mental health intervention or help has always been thought of a very private sense. And I think people are still in that era or in that space where they think this is very private. But one of the things that happens when you are in a private space, maybe with your psychiatrist or your doctor or your psychologist, one of the things that they would do, they would actually help you to they will help in empowering you to be able to, acknowledge and accept that, I've got a condition that is treatable. And as a result, they get to a point where they're actually able to feel comfortable talking about it. If you had listened to the DP's experiences, she was saying she started actually experiencing all those things. She was actually not knowing what was happening, and she was lucky to have a mom who is a medical doctor, and the medical doctor knew that, you need to go and get help. And I think out of that in itself, I think part of therapy could have involved, being empowered and being given skills to be able to acknowledge and accept, and being able to talk about it the way in which she is talking about. Yes, that needs to be done. We really, really need to encourage people to come out and be able to actually get help and talk about what's really happening. That's also helping others to be able to get help. Thank you.
Thank you very much, Mr. Mkoti. Okay, let's go straight to the questions that are also here that people have raised, Mr. Mkoti. I think the one other questions that Dr. Rachidi has just asked here was that you have mentioned on your presentations, and a whole lot of men are the ones that women are more depressed than the ones that that are more depressed than men. But what she was also touched was the issue that a majority of women who are depressed, they resort to drinking alcohol. And because they resort to drinking alcohol, she has mentioned the issue of Dr. Vuyo that he just touched a little bit there. How do we go to a point where we're able to identify those colleagues of ours that resort to alcohol or alcohol abuse, and because they're trying to get a coping mechanism out of it? That is the question that comes from Ms. Rachid. Would you be able to attempt to answer that?
Okay, the question is, how are we able to identify and assist them? Is it the question?
Yes.
Okay.
Yes.
I think one of the things that you will be able, if you're very close to a person, I think one of the things that you'll be able to, if you start seeing a change in a person's behavior or way of doing things, you know, for instance, I'm sure maybe Dr. Yoga can also identify with this. Remember, when you start self-medicating, using alcohol, for instance, as a way of dealing with your problems, one of the things that will actually happen is you might actually isolate yourself from the friends that you used to actually go out with, because sometimes you even want to actually hide to them that you actually are doing that. But I'm just saying, if you start noticing a change in behavior, whether be it, you know, isolating themselves or doing things that, you know, are out of character, that is when you can actually talk to a friend, if it's really a friend, to say, you know what, I'm really very worried about what is happening. Is there anything that really stresses you? Would you like to talk to me about it? I think I was talking to a colleague of mine during the day, where one of the things we're doing, we're actually talking about doing something about patients who are actually attempting suicide, because you find that they think psychologists or the psychiatrists are the only people that can be able to actually help them. We're actually trying to come up with a user-friendly way in which anybody could actually be able to talk to people who are, like what you say, abusing substances, or maybe contemplating suicide, in a very friendly way, user-friendly way, not in a threatening way, as if, you know, you are interrogating them. As I'm saying, if you see a change in behavior, a change in the way that a person used to be doing things, a simple thing like saying to a person, I've noticed, you know, there's change in your behavior. You know, is there anything that is troubling you? Would you like to talk about that? You might be likely they might actually start talking to you about that. Or you could also say to them, if you feel you're not actually able to speak to me, maybe there are people that could actually be able to talk to you. Or if you feel you cannot actually talk to me face to face about it, you could also maybe write things to me so that we could be able to see what we can do. Sometimes you are able to actually win because you had identified that change in behavior or change in the way in which they're doing things. They're able to actually be receptive to that and get help.
Thank you very much, Mr. Mukoti. I think you have touched it and let me take one last question, colleagues, from the Deputy Chairperson of the board. The reason why is because we are already behind time. I know this type of things, mostly they are very important, they are very interactive, but I would just prefer that you write the questions down, that will allow Mr. Mukoti, and as well as the Deputy President, to answer them maybe via email. So those that are very important. But for now, I'm just taking Deputy President as the last speaker for the question, and then from there we can be able to close the session nicely. Thank you very much. Chair, can you please come in?
Thank you very much, Chair. And maybe let me also thank Mr. Mukoti and our DP for coming up very clear with this topic. We are empowered where we are. My starting point will be that the wellness of an organization is reflected by the happiness of its workforce. And many a times we do not find the workforce being happy. You get into each and every office, you will find that people are complaining and complaining and complaining. But my observation has always been especially during the COVID, after COVID, which is still there was just a whole lot of stress, which I will say depression. The world was just fatigued, too fatigued, and everybody was angry, frustrated. Most of the people ran to the drugs, liquor, alcohol, and violence. So therefore the world is depressed. And that is where I think as BMF, we should come in, go out for collaboration and collaboration and collaboration, so that we are able to play a role in terms of helping others to come back and be back to their senses. Lest if we don't do that, we will be like supervisors or bosses who do not have knowledge and the know-how of supporting those who are affected mentally. And I will say thank you very much, Chair.
Thank you very much, Chair, about your comment that you just made. This very crucial. Colleagues, due to time, I'm just very horrified that we need to end it here, because we should have ended by half. But I can see that these are one of the most important topics that cannot be able to be taking a day, just 2 hours for us to discuss. It should be an ongoing thing. Department of Health in Limpopo has taken a stance to say they're going to make mental health to be an all-year thing, that they take care of the number one, the frontliners, as Mr. Mokoti has mentioned, but number two, also they have a wing where they also take care of the community of Limpopo, to go to them and be able to do their awarenesses. I saw some of the questions there that deals with the proactiveness of us saying, let's cure. This is part of the first leg of proactiveness, to make sure that we send the awarenesses out there to our community. I would have loved that all members of BMF were supposed to be part of this particular webinar. It would have made a whole lot of difference amongst all these people. Colleagues, I'll take this time to thank Mr. Mokoti for your time, for agreeing when I really needed you to come, and you have the topic. And I guess a lot of people are now sending their responses, and also saying they are very thankful of what you have done. DP, I would really want to thank you. You're always there when I need you in my corner. And when we spoke about this particular, I knew that we have something in common in terms of sending the awareness out there about issues related to mental health. That is one thing that is clear to my heart. I'm doing it personally on my other personal issues, but I also thought I must bring it to the BMF as well, to have a dry run to see how far can we go. An all-year thing, you can see, it can't be only for today and only for 2 hours. Somehow we need to run with this thing throughout. We've got the other professional on the side with us with this thing. I'm glad with what Mr. Mokoti said about when he started to say, this is a disclaimer. And his disclaimer was, they provoke certain emotions to other listeners who are listening here. And we could be able to hear that. DP, you have touched a whole lot of us with your story and your boldness. And it was also on the positive that a lot of people who are here who are undergoing that, or who knows the other people who are undergoing it, see that we can beat this thing as long as we hold each other by hand, and that will be able to make us to make a difference out there. We need really a healthy workforce, DP, so that they can drive this economy of South Africa. That's what we need, a very healthy, mental healthy individual to drive this economy well. Colleagues, I'm going to call it a night tonight. Thank you very much for your time. And thanks for everybody who stayed until this long. Please go back home to your families. Let's have a work-balanced life. Thank you very much, colleagues, for tonight. We call it a day. This is good night.